Good morning, boys and girls. Good morning, Mom and Dad. Hi, it's Nurse Judith from Broward Children's Center. And today we want to talk about your nose. We want to talk about your tongue and how they relate. And also later on, we're going to talk about the skin. So the first thing we're going to look at the nose, which we use for smelling, and our tongue we use for tasting. And these two works together, okay? What you smell affects your taste buds. And so you find out that when you wake up in the morning and you smell bacon, some fried bacon, it just wake up your appetite. And also, if you smell a cup of coffee, Mom and Dad, that may wake up your appetite. So even some baked products, you may smell some baked cookies, that wake up your appetite and then your taste bud, and you start salivating with all the water. We salivate because we know something good is coming, either some fried bacon or maybe a cookie. So boys and girls, you want to look at the tongue and the nose. That's your nasal passage that breathe in things and tell us what's going on around. For those who are going through the coronavirus and you want to know at first, the first thing is going to affect your sense of smelling and your sense of taste. So you may want to have a scented candle that you smell each morning, and this will tell you whether or not you are affected or not. That's just a little leeway to help you recognize if you are affected with the virus or not, just by the sense of taste and the sense of smell. Now, did you know that both the sense of smell and the sense of taste are related and they are connected and they work together? You find out if you're sick, congested, or inflammation in the nasal passage, it affects your taste bud, especially if you cannot smell and the food doesn't taste the same. So you want to realize that these are signs that affect your senses just by being sick, having a congestion, having the common cold, allergies, stuffiness, congestion. All this affect your sense of smell as well as your sense of taste. Now, what you can do now, as I said, you make sure you have a scented candle to check on yourself to make sure you don't have the coronavirus. What I'm going to tell you is the difference between flu, the common cold, allergy, and the coronavirus. Some of the signs or symptoms are the same. So I'm going to talk about all that goes across the board. The first off, coughing. Chances are, if you have flu, if you have the coronavirus, if you have allergy, once something is dripping to the back of your throat, you are likely to cough. Another thing you may have is fever. All four may have fever and coughing. All four may have a runny nose. With the allergy, the person is going to have more runny nose, a constant stream of mucus with allergy, and also sneeze periodically. So that will be one of the signs of the allergy. They sneeze a lot, and some kids, each time they sneeze, you see mucus coming out. And the mucus is usually more watery compared to flu or common cold. It's a little more thicker. And so you'll see that with children with runny nose, sometimes it's allergy related, especially if it's clear and constant. Now, sore throat, right across the borders, by your postnasal dripping in the back there, that irritates your throat and cause you to cough. The coughing alone causes the sore throat. So you'll see sore throat also in flu, common cold, the allergy, as well as with the coronavirus. Anything that produces mucus, that is trying to get to your lungs. That's what happened. If mucus is produced in the mucus area, facial pain, some people with allergy may have facial pain in these areas and also a pressure headache. So that may be just from the allergy. And some, as a postnasal drip, as that fluid is trying to get to your lungs, that's the aim, it's trying to get to your lungs. So you may want to cough that up. Some people may use nebulizer, breathing treatment, to loosen up that mucus and to get it out. A good thing is, if mom and dads are out there, you can boil some water with sea salt. boil water with under sea salt. You can add some citrus like orange peel or lemon peel, and a little garlic and onion, and make it warm enough for the children. Put it in a basin, a small basin that the child can hold over their head. It creates a mist, and that will open up the airway, clean out that airway. The same thing you can do for the coronavirus as well. We call it a heat therapy. Warm, make sure sea salt is in the water, because the best thing would be a good swim, but we can't go to the ocean now. But seawater helps to clear the mucus patches and also to clear your respiratory system. By having the heating therapy, you kill virus, you kill bugs and infection. So by having that heat therapy, that warm therapy over your face, you stick your head over the heat pan. For the children, be careful, it can't be too hot for the children, but an adult can have it a little warmer, and that steam the respiratory tract, okay? And remove mucus and kill bacteria and virus because of the heat therapy, because it quite a lot of heat. Okay, so that's another one to help to clear the sinus and allergies. Okay, so the difference with the flu and the common cold, muscle pain, they will have body pain, body aches. You don't have that with a common cold. The flu, you have body aches and pain. And as I said, with allergy and the allergy, they may have facial pain. They won't have body pain, but it will be facial pain. And the coronavirus, you have overall pain, mostly in the chest area as you breathe in your throat. So it's a head to toe pain, and you may have muscle aches and pain. As the inflammation progresses, you'll have more pain than ache. Because as I said, these are inflammatory disease. So you want to eat food that doesn't increase inflammation. Inflammation is basically mucus and acid build up into the system. So you want to make sure you reduce on those food. Congestion, as the mucus continue to increase, it drains to the back of your throat, down into your chest, and so it gets into your bronchi. First it's going to get to the bronchi, then eventually get to the lungs. So you want to make sure you use the heating therapy, you use your albuterol, so there's something known as CPT, which is you not the person's lungs area, not these areas. You have the child lie sideways and not these areas. You remove mucus built up off the lungs and off the respiratory area. So you want to make sure you can do that. The idea is to remove as much mucus as possible so it doesn't affect and lead to something like pneumonia or bronchitis. So you want to make sure to get the secretion loosened out in your system as soon as possible, taking your zinc, taking your vitamins and your minerals, and fight these infections. Again, that's the flu, the common cold, allergy, and the coronavirus. Eventually, the flu can lead to congestion and also respiratory distress or pneumonia. The same thing with the coronavirus. Mucus buildup over a period of time can lead to respiratory distress, poor breathing, and labor breathing, and all these can lead to a bigger problem in your respiratory system, because we need that. Remember, I told you what comes in your mouth and your nose affect the respiratory system or the GI. And so you want to make sure what you breathe in is good. That's why I want you to use your mask to protect yourself. When you cough, you cover your cough so it doesn't spread droplets and get anyone else sick, including your family and friends and loved ones. Now, as I said, congestion can lead to wheezing. We have children with asthma, so they're more prone to things like this: bronchitis, lungs disease, pneumonia. So children who are prone to these diseases, you want to make sure that you give them a good fighting chance by building their immune system and protecting them from the common cold, the flu, allergies, and also from the coronavirus. Seek medical attention, especially if the mucus is thick and yellow. You want to see, because it's now become infectious with bacteria. So as I said, some are viral and some are bacteria infection. So make sure you seek your doctor. You will be able to tell, because they may do a culture from the throat to see if it's strep. Different things. So you may want to see your doctor if you have a thick mucus secretion. If you're having a 4 or 5 days of sore throat, you may want to seek your doctor for these things, okay? before they get any worse. So seek medical attention. And well, also, this weekend, we're expecting to have the Sahara dust that's been going around in the Caribbean. Now it's heading towards this side. So you want to make sure to wear your mask out there, especially if you know you have pre-existing condition already, like asthma or bronchitis or emphysema. Make sure to wear your mask, the Saharan dust, and you maybe have allergies too. So wear your mask outside. Limit your activity outside this weekend as much as possible. Do more indoor things. Of course, exercise. You can exercise indoor or outside to keep your immune system strong. Wear your mask. You exercise all the necessary precaution. Avoid, your 3 C's. We talk about close contact, crowded spaces, and closed spaces. So you want to avoid those things this weekend as much. And stay hydrated. Drink your water as much as possible. Now we're going to talk about the skin. And we're looking at the skin. The skin is the largest organ on the body. And it is used to protect us from a lot of things. There's pores on our skin. There's hair on our skin. So they're here for a purpose to protect you from harmful chemical, toxin, bacteria, virus from entering into our body. And so our skin is our biggest defense mechanism from protecting our skin from the outside world. Our skin helps us to tell whether the time is cold or if it's too hot. Our skin is able to tell us whether, like a teddy bear, is very soft and warm. And so you can tell when the stove is too hot, our skin tells us that. So we stay away from the hot things, the hot stove, the hot beverage. Mommy may put a cup of coffee on the table, stay away from that, and stay away from the stove. So it is important to protect your skin. And so that's what your skin does. Your skin lets you know what's going on the outside world and how it affects your system. So we're going to look at some skin disorder and skin disease. The first one is acne. Those little pimples on your face, and some get red and some get inflamed, the more bacteria. So it's important that you change your linen. That's one of the first places that you have bacteria, would be in your linen. When you sleep, things drip from your mouth, it stay on the linen, it dry, you go put your face on it again the next day. So make sure to change your linen at least once a week. Change that linen. For some people, it may be more often, especially if there's any spilt or any waste on it, you may want to change it a little often. So you want to make sure you look at your linen, make sure your towels, the towels that wipe your skin, make sure that is changed often as well, and that you have a separate towel for your skin, including a separate one for your face. Make sure when you wash your face, you have a separate towel for your face than for your skin to reduce the bacteria that can cause acne. Also, you want to make sure you reduce your sugar intake, and that is sugary beverage, and drink lots of water, stay hydrated, and that is very good for your skin. Another one is cold sore, and you'll see that amount around the mouth area. And so cold sore, you may have to seek your doctor for that, because we need to know if it's a viral infection or a bacterial infection. So that's why when we see children with cold sore, we encourage their parents to follow up with your doctors, because you do not know, you cannot treat it until you know what you're treating. Are you treating a bacteria or are you treating virus? Because with your children, they are thumb suckers, some of them, and so they pick up things and they put things in their mouth, so you never know what kind of sore throat sore is at their mouth, if it's viral or it's bacterial. Viral, in case they have a flu or they have a common cold, anything like that, that could be a viral one. But if they have bacteria from things they play with, they go to the playground, they touch things, and so these things you have to first find out first if it's bacterial or it's viral. So that's why we recommend you see a doctor, and then the doctor can detect whether it's viral or bacterial just by looking at your tongue. It will ask you to stick out your tongue, and the tongue will show certain signs and symptoms on the tongue, a patchy white area or red inflamed. Depends on what you see on the tongue. You can tell if it's viral or it's bacterial infection. So that's why we recommend when you have cold sore, you can't treat it until you know what you're treating. You have to make sure you get the correct treatment. Hives, sometimes you're allergic to certain things or you're exposed to certain things, and some red wales will come up on your hand redness, they're hot and hot to touch. They may be round or circular, or they may be random size. So those are the things. For instance, if you eat strawberries, or maybe you're allergic to berries, or you're allergic to something that you ate, the hives will come up. Or you get to touch something, maybe wool or maybe some fabric that you're allergic to. And so this will give a reaction. And so you have to be aware of what is a reaction or what is maybe a skin disorder. Rosacea, that's another thing. Some people have skin disorder where there's red inflamed patches on their faces and maybe in certain areas on their arms. So you want to make sure you're aware if you have rosacea, flush, dark, dry, sensitive skin. And so those are the things you look for. Somebody with eczema, that's another skin disorder. And so they have yellow to white flaky patches that flake off. And they may sit somewhere and you see flake all the way on the sofa or wherever they sit, it will flake off. Anything rub against the skin, they will be on their clothing and stuff like that. Sometimes it's dry and it's itchy, and sometimes it's greasy and sometimes it's oily. And wherever that rosacea is, you'll find less hair there, and it's less sensitive and more sensitive, depends on the condition of the skin. Okay, if it's red and inflamed, it may be more sensitive. If it's kind of flaky, it may be less sensitive. So you want to make sure you take care of these things. Again, seek medical advice, because chances are there is a cream or an ointment or something the doctor can give you, as well as some encourage you to eat more omega-3 that is good for your skin to help you fight these infections and these viruses. Rosacea. And so we have rosacea, we have eczema, we have sclerosis. So we want to look at these various psoriasis. That's another one. Psoriasis, it's scaly, silvery patches. And those areas are usually, it's a large area is covered. And it's commonly located in the scalp. So you can take a look at the scalp and you can see if it's flaky. Another area is the elbow. That's another place that would be flaky as well. The knees and the lower legs, and it's very itchy and flaky. And sometimes when you scratch it, the flakes just come right off. So rosacea is another one, eczema, and also psoriasis. Another skin infection is cellulites. Cellulites, and that can be bacteria as well as fungus. So if there's a little cracks in your skin and little cuts, the cellulite can enter. The bacteria can enter there and cause inflammation. Red, painful, swollen skin, oozing. Sometimes it's hot and tender to touch. You may have a fever, you may have chills, you may have rash. Make sure to seek medical attention. Again, you cannot treat something you do not know what it is. So first you want to know if it's viral, bacteria, or if it's a fungus. Based on what the doctor find out, the recommendation is given. Sometimes you give something for fungus only to find the person had bacteria. Sometimes you give something for viral only to find out that it's not even, it's fungus. So you want to make sure you seek your medical profession first, and they will recommend what is best for this cellulites. Measles. Measles are small red spread from the face and all the way to the body. And it's in 3 to 5 days, these measles, these little red spots spread all over. It will accompany with fever, sore throat, watery eyes. Again, it will affect their sense of smell and the sense of taste, so that will affect their appetite. Sometimes they will cough. Sometimes they may have a runny nose. And so these tiny red spots, which blue-white patches on your tongue. So the doctor will look on your tongue and tell which is if it's measles or if it's another infection. Most doctor will take a look at the tongue and they'll see what patches it, what's going on the tongue. And based on, because remember, if you have measles on the outside of the skin, there's measles also on the mucous membrane, like your tongue. It will be on your palate, it will be on your throat, so that's why it's so irritable when you have measles, because it's all over the internal aspect. You can't reach to scratch, but it really just is painful. So you got to remember, seek medical profession. If you're dealing with measles, okay, there's certain things they can give you to soothe some of the skin condition, as well as internal medicine for treatment. Contact dermatitis, and that's like a rash, and it's very itchy and scaly, and so it itches so much that the skin becomes raw and flush. Some may have blisters that ooze, or we call it weeping wound, or it may become a crust. So either way, you need to seek medical attention for dermatitis, because dermatitis can be viral and it also can be bacterial. Just by you scratching, you can leave germs from under your nail bed into your skin, and that can become a bacterial infection. And the brighter and the redder it is, the more inflamed it is, the chances are it's more bacterial. Another one is wingworm, and we send these children home when they have a wingworm. Why? Because it's very contagious. Once it's still red and inflamed, once it starts forming a crust, it no longer is contagious. We encourage parents to seek medical attention for wingworm. This way you can get on cream or hydrocortisone that can, and we also encourage, if your child do have it and is healing, to cover it with a Band-Aid. Why? Because it still remain contagious by touching certain area. The child may touch this area and then touch another area. That child can spread it all over their body or over to family and friends. Okay, so we encourage you to cover it for a few days. And once the child is home, you can remove the Band-Aid. Why? Because you want it to dry. You want it to get as much air so it can dry quicker. So we don't want it covered all the time. It just cover when they're going to be in area where they're like contact, touching each other. You want to make sure it's covered so that it doesn't spread. Okay? And seek medical treatment as soon as possible. The chicken pox, clustered of red, itchy, fluid-filled blister. Notice I said, look, that's the difference between the chicken pox and the measles. The measles are little red dots, red spot. And then the chicken pox is a fluid-filled blister, varies in size and stage of healing. The rash accompanied with fever, body ache, sore throat, loss of appetite. You remain contagious until the blister have formed a crust. So you gotta realize it's ooze. This one ooze and it's fluid filled. And so that's the why we know the difference between chicken pox and measles. Impetigo, that's another one. A common disease among babies and children. It's a rash, usually located around the mouth. It is also located also on the face, the neck, and the nose. So these areas is where you will more likely to find the impetigo virus. And this is an irritant rash. Fluid fill again, blisters, it pop easily, and it leave a honey-like crust on the outside of the skin. So you gotta realize there's different disease and there's different way to treat them, because some are bacterial, some are viral, and some are fungus. And so you want to make sure you seek your doctor, and the doctor will recommend the treatment that is best for this disease and this skin. The last one I want to touch on is diaper rash. A lot of children do have diaper rash. They're more sensitive to certain diapers. So find a brand that works best for your child. Change the brand. If something is irritating your child, change the brand. Another thing you can do is provide a border. One of the best border is vitamin A and D ointment. That's the best border to protect your child's skin from the diaper rash. Wherever the diaper lie, make sure you put the vitamin A and D right there, A and D ointment right there to protect your skin. Change the diaper frequently, and that's another thing that prevents diaper rash. Now, some of these treatments can be treated with hydrocortisone. Again, you need to know what you're dealing with so you can treat it. Zinc oxide, there goes zinc again, you can use to treat these things. Antifungal and antibiotic cream. You have to see the doctor to know if you have fungus or you're dealing with a bacteria. So, and sometimes you may need a combination, because from having the fungus, scratching may lead to bacteria. Cream an ointment with steroid, and we don't really recommend steroid for children, but sometimes it get that bad where your child will have to get on steroid. So you have to find out, and steroid cannot be given unless you seek a medical profession. So these are the things you need to know. I'm just giving you some basic ones to let you know when your children have these things, you're not sure how to treat it, seek a medical profession, and they'll let you know if you're dealing with virus, bacteria, or fungus. These things affect your skin and body. And have a great day. Again, take your vitamins and your minerals. I'm stressing that because these things protect your skin as well. Have a great day now. Bye, boys and girls. Bye, moms and dads. Stay safe. Stay healthy.